Hello everyone, you are welcome to my YouTube channel, Odoctor. My name is Dr. Osinana Ajon. Sorry. I'm a medical doctor in Nigeria and I make videos that help to promote people's lifestyle and to create awareness about disease conditions. Okay, today I will be talking about pentazocine addiction. I have made several videos on this topic and I'm repeating this one because it is really helping. So many persons are, giving testimony that at least they are benefiting from it. So I want to tell you some of the practical ways that you can use to liberate yourself from pentazocine addiction. Let me tell you a brief story behind this video. I once saw a patient who was addicted to this medication called pentazocine. Okay, let me show you what it looks like. Okay, so this is the what I'm talking about, the pentazocine. Okay, so this young lady, she has sickle cell anemia. Her genotype is SS. So because of her painful crisis, which she usually have very often, she now got used to this pentazocine and continued to inject herself with this drug. Eventually, she became addicted and sustained a very big wound. So when she presented, it was quite scary. She nearly lost that hand, but eventually we were able to salvage the situation. So I've made several videos on this pentazocine addiction, and so many persons. I never knew this is so common, and you never know until probably you see this video. Okay, I never knew it's common, and so many persons are actually dying in silence. So that is why I, humbly enjoin you to share this video to as many people as you can, because we have informed you and we have not informed your friends. Okay, so the practical ways that can help you to liberate yourself from pentazocine addiction. By the way, what is pentazocine? What is pentazocine? It's a medication, usually come as injectable. It belongs to a class of drug called opioids. Opioids are a class of drug that's usually used to control pain. But it has one characteristic which you must beware of, which is its capacity to, become dependent on. All right, you can get addicted to it. So that's one characteristic of opioids. And other drugs that belongs to this class are tramadol, morphine, and heroin. Okay, so that is by the way. Let's talk about the practical ways to liberate yourself from this pentazocine addiction. There are 6 practical ways that I have listed here, which if you follow it meticulously, by God's grace, you should be able to liberate yourself from this web of addiction, because it's really something that many people are suffering from, but they can't really stop. All right, number one is recognize the fact that it is a problem. Okay, that is number one way to solving it. When you recognize that you are actually addicted to this drug, then you are halfway to solving the problem, which I believe this video should be able to do. Okay, if you have not known that, hopefully please know it now that it's a problem. And if you are watching this and you are not addicted, glory be to God, but please kindly share to help your friends to be aware of it. So when you recognize the fact that it's a problem, then you proceed to the other tips. The second tip I will tell you is, there should be a dose dependent, withdrawal from it. Okay, you don't just stop it abruptly. It doesn't work that way. You will relapse and even, have more catastrophic symptoms. Okay, so you gradually reduce the doses that you take. If you take it once or 3 times every day, you can start by taking it once. Okay, if you take it once a day, you can now start by taking once every 2 days. Or if you take it once every 2 days, you can start by once every 3 days. So you gradually, keep reducing the dose and the frequency. That way your brain will start readjusting, because what happens in addiction is because your brain is rewired to see taking that medication as something normal, that whenever you don't take it, it becomes abnormal to the brain. Okay, but you need to rewire the brain for the brain to recognize the fact that taking it is actually the abnormality there, and not taking it should be the normal. Okay, so that's a dose dependent reduction. The third one is you have to make it scarce to yourself. Okay, you don't buy a pack of it and keep in your house and then expect yourself to be free from it. Okay, you need to make it not easily available to yourself. Just be that disciplined. That is a way of helping you to stop it. Okay, so make it less available to you. You can even go to the extent of approaching the pharmacy or the wherever you get it from, that whenever you come for this drug, that they should please do not, they should not dispense it to you. Remember, after all, it is a prescription medicine. Okay, you are not actually supposed to have your hands on this medication without a doctor's prescription. However, we have found ourselves in a country where, okay, the next one is you need to publicize your urges. Okay, I don't believe that you can just take this thing in public, can you? I doubt so. So you most likely take it in your privacy, and that is another way of another way you can use to suppress the effect. Okay, try as much as you can whenever you have the urge or this feeling to take it, just leave that place and go to an open place, a football watching center, a cinema, a market, wherever there are people, so that you dissipate that energy, so that you reduce that urge. Okay, that way can help you to gradually withdraw yourself from this. Okay, the next is replacement therapy. The medication is actually a pain medication, it's a painkiller. Okay, so if you are actually taking it because of pain, then simply approach your doctor and request for an alternative pain medication that can control your pain. That's not this one. Okay, but most people that are actually addicted to it are no longer having the pain. The pain is usually the trigger that made them to start taking it. Like one woman said, it was due to when she had her CS, she was having so much pain, and the doctor placed her on pentazocine, and before you know it, she started buying it herself, and since that time she has become addicted. Okay, so pain is usually where it starts from. You want to control the pain by all means, and gradually you see yourself being cobwebbed into this addiction. Okay, so a replacement for that pain medication should be topmost priority. But then if the pain is no longer there, then you can also look for something else that can replace. They say to stop a habit, just replace it with another habit. Okay, so you can replace this pentazocine addiction with a less harmful substance that you can take, that can give you that possibly that feeling that you have taken something. One lady told me that she takes ginger. Okay, whenever she feels the urge to take it, she will take ginger, and that ginger will give her a kind of feeling that she has taken something, and that will suppress that effect. Okay, and that thing you can also take is your coffee, tea, or gum or sweet, that has that kind of coffee taste. That can also give you that euphoric satisfaction that you would get from the pentazocine. Okay, and finally, if all these measures are not working, then you may need to see a doctor in the hospital, or possibly a rehabilitation center where you would undergo a form of detoxification, okay, from this pentazocine, and you may be prescribed a medicine like methadone or naltrexone that would help to reduce those symptoms and cravings you are having from the effect of this drug. Okay, so I think these tips should be able to help, and if they are not helping, then all hope is not lost. You may wish to chat me on WhatsApp. Please do not call. If there's anything, do not call, please. Okay, and if there's any question you have or any information, you may just drop it there. Okay, if you do not know any hospital around you, you may also chat me private. I can refer you to anyone that is close to your location. Okay, I think that should be all. Let me summarize. Number one, you need to recognize the fact that is a problem. Okay, number two, you need to do a dose dependent reduction, either dose dependent reduction or frequency, reduce the frequency. Okay, the third one is you make it scarce to yourself, make it less available. Okay, then the fourth one is publicize your urges. Do not die in silence. Go out, go to the public, so that you suppress those cravings. Okay, And then the fifth one is replacement therapy. To replace a habit, you need to replace it with a mild, less harmful habit. And in this case of pentazocine, I just told you a lady normally takes ginger, and I just told you about coffee, gum, or tea, or sweet. Okay, that can give you those euphoric satisfaction. And then finally is detoxification or rehabilitation in a hospital, where doctors will, or professionals actually would handle you, and you may prescribe the medicine that would help to reduce your symptoms. I believe this should help. Okay, if you have actually gotten a value from this video, please remember, drop a comment. If you have any experience with pentazocine, please kindly drop your comment. I would like to hear, and I'm sure so many persons would like to read it too. And then if we have informed you and not informed your friends, please kindly extend that hand of kindly extend the message by hitting the share button and sending to them, so that they will also get the news. All right, so thank you for watching me, and then see you in my next video. I remain your friend and brother, Dr. Odoctor. Bye bye.